Good morning. I'd like to welcome you to the Tuesday, June 4th meeting of the St. Joseph County Board of Commissioners. Please stand for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. First item on the agenda is our accounts payable docket. Do we have a motion to approve?
Moved.
I'll second.
Commissioner Dieter, how do you vote? Commissioner Baxmeyer, how do you vote?
Aye.
Motion carries.
Next is the certification of the Director of Health. Is anybody gonna?
Diana, you want to come up? Just a little background. So this
Just the back-
process,
Just the background.
this process was changed a few years ago. The Board of Health votes to choose a new director when one is outgoing. Once that's done, it goes to the council for approval. And then the commissioners technically don't really have a vote. It's a shall certify. Basically, it's you
What?
shall certify is what the statute says. So although we're addressing it today, there's no legal requirement for a vote today.
Dr. Prosciutto.
Hi, thank you for the opportunity. So I agree with everything Mr. Mish has said. So we're excited to invite Dr. Migliori to take the role of health officer. I'll be stepping down and have resigned as of June 6th. And she's received full support from the Board of Health. They did a really diligent job of identifying candidates, looking at opportunities to create a structure for the Department of Health that would allow us to move forward with our current strategic plan. And I think they found an excellent candidate. So I think this is going to be a good opportunity. And then hopefully I'll be able to stay on as a consultant to work with Dr. Migliori in moving the Department of Health forward with our excellent staff.
Great, thank you. We've all had the opportunity to speak to Dr. Migliori over the last few days and appreciate her candor and talking to us. I think the one item that kept repeating itself was her role with the clinic that provided alternatives for birth control, specifically abortions. And my personal concern was that this would somehow politicize the Board of Health. And all of that, her involvement with the clinic occurred well before she became a member of the Board of Health, and really has nothing to do with being our health director of health. I am convinced that she is not going to politicize that office. And one thing that came through, that was the only, if you want to call it negative, the only negative comment. Everybody I spoke to speaks highly of her skill, ability as a physician. And that's really what this is all about, is directing the Department of Health to provide healthcare to our population. And for that reason, I know Mr. Mish said we don't have to vote on it, but I'd suggest we will take a vote on it.
And you do have several people who'd like to comment on the health director. If you want to take comments now, or you want to wait till the end of the meeting.
We can take them now.
Cheryl Nix.
You need to step up to the microphone. You should have sat closer.
I actually wanted to talk at the end of the meeting, so I'm gonna get to talk at the end of the meeting too, correct?
No, I'm just kidding. Go ahead.
I would just like to say that I'm excited
Yeah.
about Dr. Cheryl
For the
Nix.
record.
Cheryl Nix, Clay Township, sorry, and I have signed in. I would like to say that I'm excited about Dr. Migliori. I've attended some Board of Health meetings and always found her to be great with working with others and understanding the big picture and the importance of public health in our community. So I I'm excited that she's going to have this opportunity. Thank you.
Next is Karen Heff.
Thank you for taking my commentary. My husband is retired.
I'm sorry,
physician.
could you identify yourself? for the-
Yeah, Karen. My name is Karen Heffernan from Public Health Community. I do live in Elkhart County, but I wanted to come today to support the team. I'm a family nurse practitioner. I have a master's in public health, epi-biostats, and I was a research dietitian. So I believe the medical community at large would like to see continuity within the division. And I believe the one physician will help with CTSI exposure. So we stay in the top 25 cities for public health. We're already ranked as a livable city. And I think the other physician will reduce the turnover. And these are important fiscal imperatives. For every $1 we use in public health, we save 4. So public health has been called the enterprise of improving public wealth. And I think these two positions represent that future.
Thank you. Mike?
Barbara Carmichael. And then, thank you. Thank you.
Good morning, and thank you for the opportunity to speak. My name is Alfred Guillaume, and I live in the Harris Township. I read in the paper this morning that South Bend is no longer a dying city. I would love to keep it that way. Vibrant city needs a strong health department, and I'm strongly supportive of Dr. Migliori as our new health director. Thank you so much.
Thank you.
That's all.
That's all.
Well, just
wanna-
to comment, President Baxmeyer's, I don't think it was negative comments that came in. It's the traditional thing that we deal with every single day of misinformation and people's opinions other than the facts. So I've had a good meeting with her. I like her. I think she's going to do very good for St. Joe County, and thank y'all for coming to show your interest of what is going on. And are we also in the top 25, just like South Bend, the city, are we in top 25 counties in the United States now? I think we're
By inference.
24th, I believe, was for edification. But thank y'all.
I just want to note that the health board was unanimous in their recommendation that Dr. Migliori become the director of health.
And the council was a 5-4 vote.
Well, the council was a little different, but
Okay.
still, the majority supported that. And I will make the motion that we ratify, what's the proper term, Counselor?
Ratify the recommendations of the health board and the council.
I'll second that.
Well, Mr. Dieter, how do you vote?
Going aye.
And Commissioner Baxmeyer?
Aye,
Motion carries.
thank you, congratulations. Next item from IPG, the ratification of approval to apply for the Chrissy grant.
And just a note before Frank starts talking, Steve Francis online did want to comment on this once Frank does his thing.
Good morning, Commissioners. Asking today for ratification of approval for a Chrissy grant. The Redevelopment Commission entered into a partnership with Elkhart and Western Railroad and Patriot Rail for the submission of this Track 2 grant, which is a study grant for design engineering to see about the possibility of extending the line up to the Canadian National rail line. It was decided pretty late in that process that the grant would be more competitive if the county was the grantee rather than Elkhart Western Railroad. So I know that Bill Shalio met with Commissioner Baxmeyer, and because we were up against a very quick deadline to get that submitted, and we were asking now for a ratification of the approval to submit that grant.
What's the grant worth, Frank?
The grant is for $996,000. Our portion of it would be 96,000, and the redevelopment commission has already pledged that money.
Any further questions?
Negative.
Do we have a motion to approve?
I'd like to. Thanks.
Oops, oh, I'm sorry, I thought you meant at the end of the,
If you want to let him comment in the middle, you can.
Steve, why don't you go ahead, but just identify yourself, please?
Sure, Steve Francis, Judy Lake Drive up in Clay Township. Yeah, I don't have a problem with the grant, and particularly if it's improving safety. But given when I read the grant, it also mentions possibly the establishment and study of establishing a multimodal facility along the Capitol Avenue corridor. And I just want to flag that to some extent, because at the St. Joe Farms meeting, which was attended by 150 to 200 people, we were told, well, not really under consideration at this point. And then I see it pop up as a possible justification for this grant as well. And I just would like that as this progresses with NEPA approvals and such, there are sensitive areas along the Capitol Avenue corridor which need to be protected, environmentally sensitive areas. It's in the Capitol Avenue Management Plan of 2003. And there's no real update of that plan. Multimodal can be a very large and noisy facility where truck traffic is brought down Capitol Avenue, transferred from trains to trucks and vice versa. And in that area, we have a healthcare complex facility up in the north. You have an athletic recreational facility across Capitol Avenue on Cleveland and Douglas. I just think that advising the public, getting public buy-in, if you want to do that early on, is much more important, is very important, and to let the public know what really is going to be planned for industrial development up the Capitol Avenue corridor, particularly the establishment and size of the multimodal. Thank you.
I made the motion.
I seconded it.
Commissioner Dieter, how do you vote?
Aye.
Commissioner Baxmeyer, how do you vote?
Aye.
Motion carries.
Next, ratification of the FEMA closeout quitclaim deeds.
Yes, the FEMA grant that we applied for several years ago after the flooding in the Jewel Woods area is quickly coming to a close. One of those programs does close on June 18th. In the final preparation, we asked the Indiana Department of Homeland Security, who's the administrator of this grant, to review all of our documents and language. And after talking to FEMA, they found that we were originally given some language that they wanted in the deed restrictions, and they have since we have purchased those and got the deed restrictions, they've amended their language and are asking us to include that amended language onto the deed restrictions. And their preferred process was to quitclaim them to ourselves rather than to issue an affidavit in native title. So we are asking that you approve these quitclaim deeds so that we can record them and get the grant closed out.
This has been reviewed by legal counsel and we're good with it. With that, we have a motion to approve. I'll second.
Commissioner Dieter, how do you vote?
Aye.
Commissioner Baxmeyer, how do you vote?
Aye.
Motion carries.
Thank you.
Thanks, Frank. Mr. Metters.
Good morning. Sky Metters, Department of Infrastructure Planning and Growth, office on the 7th, 11th floor. I guess I should have let you say what the item is first, so
I should.
my apologies.
It's the bid award for highway materials, and I'm not going to bore everybody with the listing, but there are 5 of them.
And we can do all these at once, right, Mr. Mish, since it's, okay. Thank you. So what this is we got our, last week, our highway materials annual bids. And there's several of those and they're awarded several ways, and they're awarded based on location, based on certain type. And what we're asking is that we recommend that all bids be accepted and that we will purchase the material based on the low bid first. If they're not available, then we move to the second lowest bid and so forth. So they're all awarded the contract, the bid, but we get the material based on availability, and it starts off with the lowest unit price, and then we move to the next if they're not available. Recommend you accept these. We've reviewed them, and I'm happy to answer any questions.
Like the number one, the second word, could you pronounce that for our surveyor? He's kind of confused on that.
Bituminous patching.
That would be, what is, explain that word?
That's the cold patch that we put in the
Hey,
holes for
Bobby,
the
see,
potholes.
we got it. Okay, he was right.
Shouldn't doubt Surveyor Krasinski.
And Scott, this is the way,
Verb, adjective? What
What's
is
that?
it's a noun, I think.
Yeah.
This is the way we've done it in the past.
Oh, yeah, this is for as long as
Accepted
I've been
them
here.
all, and you always work to,
Correct,
as you award the lowest.
correct. And if anyone's wondering the unit prices and who's the lowest, the bid tabs are on.
They're all
On the-
here and they'll be in our
Correct.
minutes.
Yes.
Commissioner Dieter, any other questions?
Sure, at the end, Sky, what do you think the total cost of these 5 items would be? Ballpark?
It's hard to say. We have a budget for cold patching of, just say for that particular item of, I believe, a couple 100,000, because we use a lot of it because we have a lot of potholes, but, and then like the bituminous AE90, we use that for chip seal, and that budget, I believe, is around 800,000, but the others, we may not even use some of these
Are we
items.
able to use any of the stuff that's out at the manor and that? lot?
We are using that as we can. Yeah. We're trying to use as
We
much
use
as we
those
can.
leaves for something?
I wish we could, but we can't.
Deal with the leaves. Anything else?
No, good.
I'll make a motion that we approve the bids for the highway materials. Commissioner Dieter, how do you vote?
Commissioner Baxmeyer, how do you vote?
Aye,
Thank you.
thank you. Now we will move on to other public comments.
All right, Cheryl.
It's the first time in history somebody's been able to speak twice publicly.
I think so.
Okay.
Well, I like to be first at things. I like to, initiate things. All right, Cheryl Nix, Clay Township. Now that Dr. Migliore has been appointed as a public health officer, I would like to ask that the commissioners appoint a Board of Health member that understands their role on the board. I assume that you're going to be in charge of the next Board of Health appointment. Is that correct? Anyway, but I'd like it to be somebody who's not going to be concerned about home builders and their profits, or concerned about realtors and their profits, and is not confused about science, and opposes proven strategies and best practices for the prevention and spread of disease. The role of any member of the Board of Health is to safeguard the public health of St. Joseph County residents. As you stated at an earlier meeting, that even after you rescinded the resolution that required you to interview candidates, you would continue to do so and call on them to make applications. So I would like for you to follow up on that. Interviewing applicants for the Board of Health. I would appreciate that we find a great candidate to replace a great candidate. Thank you.
Thank you. Anybody else wish to,
That's all we got unless Dan has something now.
do we have anybody on?
Dan? Recap the drainage board meeting?
We don't mean to drag you up here, but
Dan Caruso, 305 Compton Street, New Carlisle. I was just talking to Sky. I was going to congratulate or thank Sky Metters for the new signage in New Carlisle, just all over the place with the truck restrictions, and with the actual enforcement of those restrictions, using our law enforcement on overtime to keep the trucks off the roads. My friends all down in the community say nothing, no more trucks coming up these restricted roads. But I pointed out to him, and I don't know if anybody can do anything about it. I came through town. I went to the west end of town this morning to eat, and coming back through, I came up 20, and I got behind one of the trucks coming into the shredder, and with his load uncovered, and a hunk of sheet metal comes off the top of that and hits in 20 in front of me because their load is no longer required. That was an old commitment made by like the original owner of the shredder, and then each successor owner isn't held to that restriction. And I was just asking Sky if they could do something to make them cover their loads, at least since I understand that it's a problem for them to come up Larison now because you can't turn left on Larison off of 2 coming from the west. You have to go make that U-turn up there at Snowberry and come back. So yeah, I understand why they're using 20, but at least for now, can they at least tell them to cover their loads coming through town? Thanks.
Thank you.
Someone's on tour by the way. Sure. What's that? They're on tour. Yeah. Okay. Yeah.
Anything else?
Can I ask one more comment? Oh. The CDC ranks boards of health by 4 divisions, okay? They have the ability to look at 4 types of local Department of Health strategies. And one of the ways they've been suggesting is that if we're going to do all 4 elements of it, we can look at boards of health to compare and see if we have enough disciplines, like you're saying. So do we have a dentist? Do we have a nutrition counselor? Do we have physicians? Do we have pharmacists? And that I think we can get from the data council at the Indiana level. So if you'd like us to do it and volunteer and send it, it might be one way of just scientifically looking to see if we compete with the other cities that are trying to compete and be livable. So bringing all the disciplines forward with the most comprehensive approach to public health is the best science behind it. And it would be easy to gather that data for you.
Now, if there are no further comments, entertain a motion to recess. Second.
Commissioner Dieter, how do you vote?
Forgot he was
Commissioner
here.
Baxmeyer, how do you vote?
Aye.
Motion.
Thank you, everybody.